Okay, I'm live. Let's get this turned around. Okay, good morning. Good morning. I'm doing another scope. Thank you for tuning in with Mind Your Mind with Jermaine. Doing part 2 of discussing post-traumatic stress disorder in urban communities and urban violence impacting our communities and our young people. In part 1, just kind of give an overview. I kind of define, what is post-traumatic stress disorder. I talked about some of my experiences, and so I would definitely recommend to look at part 1 of my Periscope if you haven't had a chance to review it, so that you can kind of get more in tune to the flow in part 2 that I'm discussing today about post-traumatic stress disorder. And I said that in part 2 that I was going to kind of focus on some of the internal and external factors and symptoms and solutions to address post-traumatic stress disorder impacting youth in cities like Chicago and other communities of violence. And it's not just isolated to communities, impoverished communities and urban communities with African Americans. You have Latinos and I think are impacted, in impoverished communities like Chicago, LA, and the thing that happened in St. Louis. So I think a lot of those places, need help. We need solutions. And I said that I talked about that violence is not normal. Laying on your floor, until the gunshots are done is not, normal living. It's not normal. But for many of us, that type of environment has become the norm. And you can just turn on the news at any given time in the city of Chicago, or to look on the news from Illinois and look at the news and see the reports about Chicago and the uptick in violence that usually happen when the weather is warm. But it seems like all 4 seasons is not discriminatory when it comes to criminal activity and violence in the city of Chicago now. And that's a real cause for concern. And there's a real call and need for trauma centers in cities like Chicago. And I think that that's really important. I think that policies in city government should be geared toward addressing that, and federal resources, monies, grants should be poured into cities like Chicago to address that. And communities of faith should be on the front line of addressing that issue as well, because communities of faith, the faith community serves as a staple for African American people, has been a hallmark to African American families. So I think that churches should be on the front line to address and to deal with mental health issues, and providing resources or being one of the vehicles to help bring awareness, provide resources for families that have been impacted by violence, and offering maybe open forums, groups for families in their particular congregation, to help them build some skills, some resiliency to live through these things, and to minimize some of the effects of post-traumatic stress disorder. So I I wanted to talk about some of the things that I've read from the National Urban League and Policy Institute. I think their research for me, as I looked it over, I have been looking at their research for the last couple of years now and just reviewing it. And I think their research is really phenomenal and giving a real breakdown of the impact of urban violence in urban communities. They give a real breakdown and real good information on statistics and solutions on how we can address these things. And so I'll be pulling from that resource, and I'll be posting links for resources for people that may feel that they themselves may be experiencing some form of post-traumatic stress disorder, or that their children or family member. So these will definitely be some resources that you can call, contact, and do some research on your own to be more informed about it, and reach out to the local mental health institutions or facilities in your area, and ask them, the doctors, physicians, psychologists, or social workers, to help you or your children or your family member to get past these things and find some resolve in your life, that you can to live and function and cope in spite of the violence that you may have been directly or indirectly impacted by. And so I said I want to look at some internal factors and external factors of the effects of post-traumatic stress disorder and how they manifest in our youth and our teens. And I think there's a video that had been floating around Facebook. It's out of Florida, and there's a scene where these youth, I think they were 15, who were on 16, they were on a high-speed chase in Florida. The police were chasing them. They had a stolen vehicle and on a high-speed chase, and you can see in the video the kids out the car running. So they eventually got caught. And so while they was at court, they were acting out, having outbursts, being disrespectful to the court, to the judge. And so then the parents got involved, and it was kind of crazy. So the video is floating around on Facebook. And I think that from some of the comments and articles I read about it, the people statements were like, well, I'm ashamed, I'm African American, and I'm ashamed, is this, Black America's future, and, a lot of negative comments. And when I looked at the video, I kind of, you do get upset about it, about their behavior. But the question that I asked, and I think that's my background in social services and the trainings that I received and being a social worker. Now I think I look more deeply, and ask the question, what's going on with them, and you can look at them and tell just by their mannerism, their characteristics, that there is some underlying issues, mental health underlying issues going on, with these young people. And so, and I didn't see any comments, addressing that. So I think that is a classic example of the impact, some of the external factors and manifestations that can happen when a kid experience and grow up in a culture where violence is normalized. This adds to their beliefs, their ideology, and how they look at authority, and how authority is not being acknowledged, and so it's just it's a free for all, the police, we disrespect the police. And I think with the uptick in the exposure of police brutality, and the overuse of force by police, and the corruption with that, there's a distrust that's there with authority figures. And then I talked about that these issues are layered. So you take a teen like that, like those kids in Florida in that video, and what is their home setting like? These issues are layered, and you throw urban violence in that, you throw poverty in that, joblessness in that, no access to mental health resources. What's the setting at the school system like? Some of our schools are underfunded. They're overcrowded. The teachers are not given the resources that they need. So these issues are layered in addressing the impact of violence in our communities, in urban communities like Chicago or that particular area in Florida. So these are layered things that are happening in our communities. I want to just touch on this here about some of the internal and external factors. And this is from this website here is the U.S. the National Center for Post-Traumatic Stress Disorder. And even though this is commonly identified in veterans, research is finding that these same symptoms are showing up in people that have been exposed to some level of trauma, including violence. So here it says, in this review, it's shown that in this case, sexually abused children often have problems with fear, anxiety, depression, anger, hostility, aggression, sexual inappropriate behavior, self-destructive behavior, feelings of isolation, stigma, poor self-esteem, difficulty in trusting others, substance abuse issues. And these symptoms are, even though that's sexual abuse, but trauma is, they share some of the same symptoms in a person that's been impacted by trauma. And it says that alongside those type of disorders, those internal disorders, isolation, anxiety, depression. I think depression is one of the biggest ones. And thoughts of suicide, those things that sometimes that are there that are not easily identified. But the external factors and external issues are kind of easily identified, especially with those children stealing cars, running from the police, being disrespectful to authority in a courtroom, that optional defiant disorder, conduct disorder, panic disorder, hyperactivity, disorders, so anxiety, some of those external factors deal in the impact of post-traumatic stress or any form of trauma upon teens and children. And so some of the solutions that in recommendations that the National Urban League suggested was the need to improve and expand school mental health programs. And I think that is an excellent idea. These are more targeted because children go to school, teens go to school, and having something housed within the school setting, train the educators, the staff to be more informed at identifying trauma related issues and making the proper recommendations and referrals to community resources to get those teens and their families some adequate mental health resources. Also within the school setting too, peer-led groups. I think peer-led groups are phenomenal, and that gives an opportunity to educate the youth and be led amongst themselves with a social worker or a psychologist kind of overseeing and supervising that type of groups for teens. I think that'll be excellent. And also educating our teens, just like learning first aid. And we've been taught how to stop, drop, and roll. Some type of education, informed education on teaching our young people how to deal and how to process through crisis and how to help somebody else, going through crisis, some of the techniques and skills, and kind of bringing it down into a way where teenagers and young children can grasp those concepts that are associated with crisis intervention training that mental health professionals receive. So I think that having teens empowered like that, would only build upon their resiliency to address these issues themselves and identifying in their peers and be an outlet for their peers as well and helping one another. So I think improving and expanding school mental health programs is very important. And so we need advocacy for change in policies to see funding for that. They said incorporate evaluations of mental health in primary care settings for children and adolescents. And so when they go to the doctor and having the physician informed and aware, to identify some of these symptoms and where to go get adequate help and resources to address post-traumatic stress disorder or some type of trauma-related counseling for our teens and youth. Another recommendation they made was increased collaboration between community leaders, families, schools, and mental health providers. And so I'm passionate about that, and I'm working on some projects locally in the Kankakee area to get some of these things up and running, and to provide resources and to connect resources and to have a collaboration amongst the different systems and institutions so that our people impacted by violence can have adequate resources. And so that's kind of why I'm doing these posts, and to raise awareness about mental health issues like post-traumatic stress disorder, depression, preventative means and that we can undertake even ourselves. And I think that one of the statements that was made here in this research, I like this. It says that it should start at home too. That the home should be a place where, and sometimes parents need help, they need training, that they make their homes an environment where the kids can talk about these things, and the parents can provide some alternatives and activities, and have family discussions about the violence in their communities, and they themselves talk about solutions that they feel that would be more impactful for them and their family. And so, happening at home and talking to your kids and your children and your family about violence and how they feel about it, how they feel about the violence. Do they think that, is there a sense of hopelessness? When you talk to your teens and your children about it, do they feel like it'll ever change? So when you see those sense of hopelessness, that's where, they can get the help, they need, or you can get the help you need, so that you can help your child to be more, to be strong and to emotionally strong, emotionally healthy, to be able to process through their thoughts and feelings about how violence have impacted them directly or indirectly. And so the juvenile detention center, I think an intervention there as well. There needs to be an intervention there. There needs to, and I like Illinois is talking about a lot of reform, criminal justice reform, and so there's a lot of policies and things that's happening around that. I think that's important. I think that the program should be reshaped, to identify mental health issues in teens that are in the juvenile detention center or in the criminal justice system, and address those issues. All right, bye, babe. So we definitely need some change. So I hope that these posts, these videos are helping you and informing you. I think under this video, I just want to focus more on solutions, and tack on some resources under my link on Facebook. I'm going to turn this into a YouTube video as well, so you'll be able to come back and replay and watch it. And I said also I was going to talk about another experience that I had with urban violence. I think I shared, one incident, and I think another incident. I was in Inglewood going to one of the city colleges, and on my way to school, there was a shootout, and it was on a particular street and block, and that I often travel, going up to school to Daly College, and the shots rained out, and the cars in front of me, everybody kind of, scattered, and my first mind was, and traffic kind of held up, and you see people running. My first mind was to, I definitely dug down in the car, but my first mind was to put my car in reverse and to not head that way where I heard the gunshots and go the opposite way. But that still small voice, that internal voice, I believe God said don't reverse, because they'll think that you were involved in the shooting in some capacity. So I just put my car in drive and my foot on the brake and kind of just eased off the brake a little as the traffic began to move forward. And so as I moved forward, I can look to my right, and I look to my right, and there's an older lady who appears to be fainting, but she wasn't fainting. She was holding her chest area here, and she was holding on. We have garbage cans in Chicago, on the street corners next to the bus stops, and she was falling, she was grabbing the garbage can, and it tipped over, and the lady just laid there, and then different people came, running to her aid. And also, while I was in the car, moving up, I could see several young men that were running, and one who was limping, and I could hear him say, man, gee, I think I've been shot. And it was just a crazy scene. And so all day I had that picture of that older lady, falling. And I was like, man, did this lady get shot? I didn't want to stop. I had to get to school, so I didn't want to be an onlooker, because I just didn't want to be in that environment. So I just went to school. And my mind, my body was numb that whole day. I couldn't even focus, when I went to school that day. And, that's the scene that, kind of lives in my mind, to see violence like that, and that's not the first time I witnessed violence like that. So, these things could be very traumatic. And imagine I'm an adult now, my spirituality has been a source of strength for me. And so that's kind of where I find my resolve. But imagine a young person, or a teen, or a child seeing something like that in their neighborhoods, and it happens on a regular occurrence. I think in the movie Boys in the Hood is a classic example of that. When they Doughboy and all of them, when they were younger and they were kids and they were walking and they see they notice the dead body. I think that their response, is classic, of seeing violence being normalized. So I hope that these periscopes, and that you will follow me on YouTube and Twitter and Periscope, as I'll be doing more, bringing more awareness about mental health issues impacting communities of color. So thank you for tuning in. I hope that this helped. All right, and see you next time.